You've probably seen a hand splint before, maybe on a friend or even worn one yourself. And you might have thought, it's just a piece of plastic, right? But what if I told you that inside that simple-looking shape is a marvel of biomechanical engineering? Well, today, we're going to peel back the layers on the hidden science behind these incredible therapeutic tools. It all starts with this number, 27. That's not a random number, that's how many individual bones are packed into each one of your hands. Just think about that. Right off the bat, that tells you we're dealing with a biological machine of just, wow, incredible complexity. And listen, that's just the bones. We're also talking about this dense web of joints, ligaments, and different kinds of muscles, all working together in this perfect, intricate dance. It really is a biological masterpiece. But with so many moving parts, it's also incredibly vulnerable. And that's where the engineering comes in. So, to even begin to understand how we can fix or support the hand, we first have to really appreciate how it's built. We've got to look at its fundamental architecture. You see, the hand's real strength and dexterity doesn't come from being flat. It comes from its arches. Just like the arches in an architectural bridge, these three distinct arches give the hand its structural integrity. It's what allows it to conform perfectly around a ball or a coffee mug. A splint that ignores these arches and just flattens the hand, it's never going to feel right, and it's certainly not going to work right. Okay, so now that we have some respect for the hand's design, we can talk about the tools we build to support it. So what exactly is a hand orthosis? What most of us just call a splint. The official definition makes one thing super clear. This is not just a passive chunk of plastic. Look at those words: support, align, improve function. That tells us this is an active therapeutic tool, something that's been engineered with a very specific job to do. And those jobs can be incredibly varied. I mean, an orthosis might be there to protect a really fragile tendon repair right after a surgery, or it could be helping someone with arthritis reduce their pain so they can just do something simple, like open a jar. The crucial point, the bottom line, is that it's all about improving a person's ability to interact with their world. And this brings us to the really fascinating part, the principles behind a smart, effective design. This is where biomechanics and anatomy truly become one. So yeah, how do you do it? How do you create a device that helps this incredibly complex structure without just getting in the way or, maybe even causing more problems? It all starts with a core principle from physics, the three-point pressure system. Imagine trying to straighten a bent stick. You'd push in the middle of the bend, right? That's your primary force. Then you'd hold the ends steady, pushing in the opposite direction. Those are your two counterforces. Every single effective orthosis is built on this simple, elegant idea. And from that core principle, all these other rules just emerge naturally. You have to spread the pressure out, otherwise you create painful hotspots. You have to avoid pressing on bony areas to prevent sores. And crucially, you have to respect those natural arches we were just talking about. A flat splint on an arched hand isn't just uncomfortable, it's ineffective. A good orthosis always works with the body. Now, these designs generally fall into two main families. First, you've got your static orthosis. This is like a brace. It has no moving parts. Its job is to hold things still, to rest and protect. Then, on the other hand, you have the dynamic orthosis. This one uses elastic parts, like little rubber bands or springs. Think of it as a tiny personal physical therapist, applying a gentle, constant force to encourage movement and stretch out tissues. So that's the theory. Now let's see how these principles and types come together to solve some real-world problems. And we'll start with a condition millions of people are all too familiar with: carpal tunnel syndrome. The problem is pretty straightforward. There's a major nerve, the median nerve, that gets compressed as it runs through that narrow tunnel in your wrist. It's getting pinched. So the therapeutic goal is just as direct. We've got to get the wrist into a neutral, straight position to open up that tunnel and relieve all that pressure on the nerve. The solution here is a static orthosis called a cock-up wrist splint. It has one simple but really powerful job: to prevent your wrist from bending, especially while you sleep. By just holding the wrist straight, it gives that compressed nerve the space it desperately needs to finally rest and recover. Okay, now for a more complex case. Imagine a surgeon has just meticulously repaired a flexor tendon. That's one of the vital ropes that pulls your fingers closed into a fist. The problem here is a really delicate balancing act. That repair is incredibly fragile, and stretching the finger straight out could literally rupture it. But if you don't move it at all, it's going to get stuck in scar tissue.
So the goal is to protect it from stretching while still allowing safe, controlled bending. It's tricky. And the solution is this highly specialized tool, the dorsal blocking splint. The name tells you exactly what it does. It sits on the dorsal, or backside of the hand, and it creates a physical block, stopping the fingers from straightening too far. It's like a safety shield. It allows the patient to perform gentle bending exercises without ever risking the repair. It's just a perfect example of tailored engineering.
But it is absolutely crucial to remember this point. A splint isn't a magic wand. It is just one part of a comprehensive rehabilitation program. It creates the ideal environment for healing, but the real work, that comes from the therapy, the exercises, and retraining the hand how to function again. And this technology isn't standing still, not by a long shot. The future is even more exciting. 3D printing is allowing for perfectly customized, ultra-lightweight designs that are tailored to an individual's unique anatomy. We're also seeing the start of smart orthoses with built-in sensors that give therapists real-time data on how a patient is healing. The future of this field is all about precision and personalization. So this leaves us with a fascinating final thought. As these devices get smarter and more integrated with our bodies, will they stop being just tools for healing and become tools for enhancement? It's a future where engineering doesn't just restore function, but could potentially expand it. Kind of makes you think, doesn't it?